We spend an awful lot of time sitting down. The way you sit is really going to determine how well your back copes with that. Chairs generally aren't very well designed, but how you use them is the really critical factor. You can sit on a badly designed chair. If you know what you're doing, it's not going to matter. You can sit on a well-designed chair. If you don't know what you're doing, you can still make a mess of it. So let's have a look at some of the basics of sitting in a chair. Here's your average office chair. Now it has an up-down adjustment and a lumbar support. Two of the really critical things in a chair if you're going to be sitting on them all day. Now, if I'm sitting too low, like this, and there's either it's dead flat through here, or I actually have a slope up to my knees. There's an upward slope in my thighs. I'm going to be in hell zone trouble, because when the higher my knees go, the more it rolls my pelvis back. You can see how that works? Like this. So if I'm sitting in a chair like this, or on a lounge, too low, sitting forward to a coffee table or something, it's really going to roll my pelvis back, and that makes my lower back, my lumbar spine, arch forward, which it's not supposed to do. Your lumbar spine is supposed to have a bit of a backward arch in it, or an extension curve in it. If you're curving forward like this, you're compressing the discs at the front of your spine, and you're stretching the ligaments, the joint capsules and the muscles at the back of your spine, and that equals pain. So if you have a desk job, you're sitting down a lot, the way you're sitting may well be contributing to that pain. It's not the sitting down that causes the pain, it's how you sit down. So you've got an adjustable chair like this, always have it up nice and high. Ideally, you've got a downward slope of your thighs towards your knees. And that automatically throws my pelvis forward, automatically helps support me in a much more mechanically sound way. Another thing you need to look out for is where you sit on the seat. If I'm sitting halfway back or 3/4 of the way back, which a lot of people do, and then I go back to lean on the chair like this and then get about my day, I'm going to be in strife, because once again my pelvis is rolled backwards and my lumbar spine is curving forwards. Big no-no. So whenever you sit down, either you sit way forward on the chair like this, or you sit right back. You get your backside right into the back of the chair so that the lumbar support in the chair can actually support you. Now, a lot of chairs don't have any lumbar support whatsoever. If it doesn't, put a cushion in there. Fold up a towel, put a cushion in to help push that lumbar spine forward. Your spine should be aligned the same when you're sitting down as it is when you're standing up. So make sure this lumbar support is pushed forward far enough to give you the support. Make sure that your knees are nice and low and that you have a good posture. You don't want to have this forward bending curve. Big problem, it's going to cause you lots of trouble. And just sit like this all day. It's not ramrod rigid, it's actually quite comfortable. Your head is sitting where it should be. It's not straining your head, it's not straining your mid or your lower back either.
Why it hurts and what you can do about it continues with part 10, getting out of chairs without pain. For lots more information or to get the DVD of Bruce's clinically proven stretches, check out jointandbackpain.com. You can help yourself if you know what to do.